instructions to report the same back to the House forthwith with the following amendment. Strike.
Reserve a point of order.
Point of order is reserved by the gentleman from Michigan. Clerk will continue.
Strike all after the enacting clause and insert the following. Section 1, short title. This act may be cited as the Consumer Health Plan Protection Act of 2013. Section 2, maintaining existing coverage. A, in general, notwithstanding any provision of the Patient Protection and Affordable Care Act, including any amendment made by such act or by the Health Care and Education Reconciliation Act of 2010, in the case of health insurance coverage offered by a health insurance issuer in the individual market that is in effect for an individual as of October 1, 2013, the issuer may continue such coverage for such individual for a plan year beginning in 2014 in such market outside of an exchange established under Section 1311 or 1321 of such Act, 42 U.S.C. 18031 and 18041. B, treatment as grandfathered health plan in satisfaction of minimum essential coverage. Health insurance coverage described in subsection A shall be treated as a grandfathered health plan for purposes of the amendment made by Section 1501B of the Patient Protection and Affordable Care Act. C, notice. As a condition for a health insurance issuer to continue health insurance coverage under subsection A, the issuer shall provide for notice to each individual to be offered such continued coverage and for other individuals covered under health insurance coverage offered by such issuer for whom such continued coverage is not offered. Prompt notice of the following. 1. The health insurance coverage options available to the individual through the marketplace under the Patient Protection and Affordable Care Act and how to exercise such options. 2. The premium and cost-sharing assistance available for coverage obtained through such marketplace.
Clerk will suspend. House will come to order. House will come to order. Clerk may continue.
2. The premium and cost-sharing assistance available for coverage obtained through such marketplace. 3. The consumer protections provided under such act that are not provided under the continuing health insurance coverage. D. Construction regarding notices of cancellation or conversion. 1. In general, nothing in this section shall be construed to prevent the Secretary of Health and Human Services from requiring state insurance commissioners A. to investigate and take appropriate administrative or other actions, such as the imposition of a fine, on cases of inadequate notices of cancellations or conversions of health insurance coverage in the individual market that take effect on or after January 1, 2014, and B, to submit to the Secretary reports on the investigations and the actions so taken. 2. Inadequate notice. In this subsection, a notice of the cancellation or conversion of individual health insurance coverage shall be treated as inadequate if the notice A. fails to contain information contained in subsection C, B. fails to be transparent by inappropriately steering individuals to more expensive plans provided by the canceling issuer, or C. fails to otherwise comply with requirements of law. E. Construction regarding protection against discriminatory rates. Nothing in this section shall be construed as preventing the Secretary or the relevant state insurance commissioner or state regulator from taking corrective actions to ensure that any excessive, unjustified, or unfairly discriminatory rates for the continued coverage offered under subsection A are corrected prior to renewal. F. Construction regarding premium protection. Nothing in this section shall be construed as preventing the Secretary from using all available tools to ensure that marketplace premiums are not adversely affected by the operation of this section.
House will come to order. Members will please take their conversations off the House floor. The gentleman from New Jersey is recognized for 5 minutes in support of his motion.
I ask unanimous consent to revise and extend my
Without objection.
Thank you, Mr. Speaker. Thank you, Mr. Speaker, and thank you, colleagues. We come here as stewards of a very sacred trust to look after the people that are the backbone of this country. And we are having this debate this afternoon because we've all heard from men and women across this country who are very upset that an insurance policy that they want to keep has been canceled. And Mr. Speaker, the House is not in order.
House will come to order. Gentleman from New Jersey.
Thank you. These constituents are very upset and very troubled, and we're brought here to work together to figure out a solution to that problem. What's the solution? Well, first of all, they ought to have the ability to have their insurance company offer them the policy for sale. Frankly, the underlying bill does that, and so does the plan that I'm presenting. But second, there ought to be some way that the insurance companies are given some incentive, at the very least, direction to sell the policy. It doesn't do you a whole lot of good to have the right to buy a policy the insurance company's not selling. And this plan has some measures which make it more likely that insurance companies would do that. Thirdly, to solve that person's problem, we have to make sure that in solving their problem, we're not creating another one. That by permitting these policies to be sold for another year, which this does, that we're not spiking the premiums of people in the exchange marketplaces or people who get their insurance through work. Mr. Speaker, the House is not in order.
House will come to order. Gentleman from New Jersey may continue.
I've heard a number of members say that they want a chance for us to work together to solve this problem. Here is that chance, because this plan does the three things that I just talked about. But this plan, I think, is different than the underlying bill because this is not a step to unravel the Affordable Care Act. It is a step to improve it. And that's the fundamental question. Because there's some other people whose stories ought to be told here this afternoon, too. There's a family this weekend that's having a social to raise money to pay the medical bills for their son or daughter who has cancer because the insurance policy they thought they had stopped paying their son or daughter's bills. Their voice should be heard. If you repeal the Affordable Care Act, their voice is silenced. There are women in this country who go to try to start a business and they try to buy an insurance policy and they're told, we won't sell you one because you've had children, you're a female, you had breast cancer 10 years ago. If you repeal the Affordable Care Act, her voice is silenced.
House will come to order. Gentleman may continue.
Mr. Speaker, there are sons and daughters of Americans who are 22, 23 years old, who didn't have health insurance before because they couldn't get that first full-time job, who now have health insurance because of their mom's or dad's policies. If you repeal the Affordable Care Act, their voice will be silenced. There are senior citizens who used to run out of drug coverage, prescription coverage, around Labor Day because the Medicare donut hole popped up. And because of the Affordable Care Act, they are now able to buy their prescriptions at an affordable... Thank you, Mr. Shimkus.
House will come to order.
I'm obviously having an effect on Mr. Shimkus, and I appreciate that. They are now able to pay their prescription bill to the end of the year. If you repeal the Affordable Care Act, their voice is silenced. We come here this afternoon to solve the problem of Americans who want to keep their coverage but have had it canceled. We want to work together to solve that problem. That's what this plan does. But when we look at women being turned away because of pre-existing condition, we will not be silenced. When we look at 22-year-olds who will lose their coverage if you repeal the Affordable Care Act, we will not be silenced. When you look at seniors who will lose the ability to pay their prescription drugs If you repeal the ACA, we will not be silenced. We are here to solve problems, not create them. If you want to work together in a way that improves this law, we are your able and willing partner. But if the intention is to unravel this protection for the American people, we will stand, we will speak, we will fight, and we will oppose every such effort. Vote yes for this motion and no on the underlying bill.
For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I would claim the time in opposition to the motion to recommit.
The gentleman from Michigan is recognized for 5 minutes.
And I withdraw our motion to, or the reserve.
Reservation is withdrawn.
Correct. Mr. Speaker, the debate today on whether to support this bill comes down to a very simple question. Why not? If millions of Americans want the choice of keeping the insurance that they have, why not? If you believe Congress acting together, not the President acting unilaterally, should try to help people who have lost their coverage, why not? And if you believe that ordinary Americans, not the federal government, should decide what their insurance plan looks like, why not? We have a chance today to provide hope to millions of Americans who got that cancellation notice. Hope that they can keep the insurance that they like, hope that they're going to have even more choices, and hope that they, not the federal government, can pick what their insurance plans actually looks like. So let me be clear. Our bill, H.R. 3350, does not fix Obamacare, the President's health care bill. It's only an attempt to help people harmed by this law. But if we can provide some relief to people from this disaster, why not? So let's defeat the motion to recommit and pass the underlying bill. I yield back the balance of my time.
Without objection, the previous question is ordered on the motion to recommit. The question is on the motion. All those in favor say aye. Aye. Those opposed, no. The noes have it. The motion is not agreed to.
Mr. Speaker,
Gentleman from New Jersey.
on that I demand the yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. This will be a 5-minute vote. Pursuant to Clause 9 of Rule 20, the Chair will reduce to 5 minutes the minimum time for any electronic vote on the question of passage. This is a 5-minute vote.
All right, so this is another procedural vote here on the floor of the House on the Democratic motion to recommit. Democrats tried one a few minutes ago, and there was a procedural maneuver there, so they're kind of trying again. While they do that, let's catch up with the big picture. We had a chance to speak a few minutes ago with a Capitol Hill reporter. Joining us, Russell Berman, a staff writer for The Hill. Good morning, Russell. So the House has been debating this bill. Now a vote going on this bill by Chairman, Energy and Commerce Chairman Fred Upton. What's the bill about?
Well, it's called the Keep Your Health Care Plan Act, and it would allow people whose health care plans have been canceled in the last few months due partially to the Affordable Care Act to keep them for another year. The President has vowed to veto this bill, and Democrats are going to try to put up their own alternative, which is very similar to what the President laid out as far as an administrative fix.
That's my question. How is this bill by Representative Upton different than what the President said he wanted to do?
Well, the chief criticism from Democrats is that it would not only allow people who were on those health care plans and had them canceled to sign up for them again if the insurance company offered it, but it would open up all of those health care plans to new customers as well, and Democrats say that would undermine the exchanges in the Affordable Care Act to such an extent that it would really unravel the law.
So how much support, if any, then would you expect Congressman Upton's going to get from House Democrats?
Well, that's the big question. Democrats are not very happy that the administration has messed up the rollout and the implementation of the Affordable Care Act. And so we can expect, I think, at least a few dozen Democrats to defect, partially out of their own political need back home, and partially to send a message to the White House about how unhappy they are. But the fact that the Democrats are offering their own alternative in the form of a motion to recommit might keep the number of defections down, because it gives the Democrats who would be considering voting for the Upton bill an alternative to say that, you know, I voted for a bill to allow you to keep your health care plan, just not this Republican bill.
So what are the details of the Democrats' version that they've offered then?
Well, they're comparing it to the legislation that Senator Mary Landrieu of Louisiana has offered in the Senate. They say it's different in that it would the Landrieu legislation would be permanent. It would allow the insurance companies to permanently continue to offer these plans. The House Democratic plan would only be for 1 year, and they say that is more in keeping with, you know, the intent of the law, and would do less damage to the Affordable Care Act.
And speaking of the Senate, if this bill does pass the House, it goes to the Senate, what happens? Anything?
Probably not. I mean, the Senate Majority Leader Harry Reid has not indicated whether he's even going to bring up the Landrieu bill. You can expect that he's not going to bring up the Upton bill, particularly since the President has threatened to veto it. So it's unclear what future it has. But, you know, if the rollout of the law continues to be problematic, then the momentum for this kind of legislation is going to continue to build, and so that's when we might have to see some action in the Senate.
Russell Berman, staff writer for The Hill, thank you very much for joining us.
Thank you.
Are 187, the nays are 230. The motion is not adopted. The question is on passage. Those in favor say aye. Those opposed, no. The impeding chair, the ayes have it. The resolution is adopted. Gentleman from California.
I demand a record vote.
A recorded vote is requested. Those favoring a recorded vote will rise. A sufficient number having risen, a recorded vote is ordered. Members will record their votes by electronic device. This will be a 5-minute vote.
And so this should be it, the last vote of the day, a final vote on this bill offered by Representative Upton of Michigan. And, of course, what happens to the bill in the future, as we heard from our reporter on Capitol Hill, very much remains to be seen. Final vote of the day here in the House, and the Senate, of course, not in session today. We have gavel-to-gavel coverage of the House always right here on C-SPAN, and the Senate on C-SPAN 2.
On this vote, the yeas are 261, the nays are 157. The bill is passed. Without objection, the motion to reconsider is laid on the table. Pursuant to Clause 8 of Rule 20, the unfinished business is a question on agreeing to the Speaker's approval of the Journal, which the Chair will put de novo. The question is on agreeing to the Speaker's approval of the Journal. Those in favor say aye. Those opposed, no. In the opinion of the Chairs, the ayes have it, and the Journal stands approved.
Where's Lawyer from? Maryland. And without objection, so ordered.
Gentleman's recognized.
For what purpose does the gentleman from Maryland seek recognition?
Thank you, Madam Speaker. I ask unanimous consent to speak out of order for 1 minute for the purpose of inquiring the Majority Leader the schedule for the week to come.
Without objection, the gentleman is recognized.
Thank you, Madam Speaker, and I yield to my friend, Mr. Cantor, the gentleman from Virginia, the Majority Leader.
Madam Speaker, I thank the gentleman from Maryland, the Democratic whip, for yielding. On Monday, the House will meet at noon for morning hour and 2 p.m.
Madam Speaker, the House is not on order.
Will the House come to order, please?
Thank you.
Madam Speaker, on Monday, the House will meet at noon for morning hour and 2 p.m. for legislative business. Votes will be postponed until 6:30 p.m. On Tuesday and Wednesday, the House will meet at 10 a.m. for morning hour and noon for legislative business. On Thursday, the House will meet at 9 a.m. for legislative business. Last votes of the week are expected no later than 3 p.m. On Friday, no votes are expected. Madam Speaker, the House will consider a few suspensions next week, a complete list of which will be announced by close of business today. In addition, the House will consider 3 bills to increase domestic energy production, create American middle-class jobs, and lower the cost of energy for our families. These bills are H.R. 2728, the Protecting States' Rights to Promote American Energy Security Act, sponsored by Representative Bill Flores; H.R. 1965, the Federal Lands, Jobs, and Energy Security Act, authored by Representative Doug Lamborn; and H.R. 1900, the Natural Gas Pipeline Permitting Reform Act, sponsored by Mike Pompeo. Together, these bills represent our continued commitment to energy independence and putting more money in the pockets of working middle-class families. And with that, Madam Speaker, I yield back.
I thank the gentleman for that information. I think, as the Majority Leader knows probably as well as any of us, and maybe better than most of us, we have 4 legislative days left in November and 8 scheduled legislative days in December, assuming we do in fact get out on the 13th, which is, I understand, the last day that we're scheduled to be in session this year. Having said that, there are a number of pressing items to address. As the Majority Leader knows, the unemployment insurance protections for folks expires on December 31st. Actually, I think it's December 28th. The permanent SGR fix expires, the SGR provisions expire on December 31st, and if we do not do something with respect to them, there will be a substantial increase or decrease in the reimbursement to doctors serving Medicare patients. I know that the Majority Leader has, and we have, people who are willing to work together to address these issues. But knowing that there is usually uncertainty at the end of the session, I would ask the gentleman if he can give members a sense of scheduling for the coming month, that is December. And I yield to my friend.
Madam Speaker, I thank the gentleman, and I would say to the gentleman, we certainly have 3 conference reports we're looking at hopefully completing with the Senate. One is the WRDA conference reports that we voted on the House this week to go to conference. The other is the Farm Bill conference report, as well as the NDAA, the National Defense Authorization Act. I would say to the gentleman, Madam Speaker, that those are certainly the conference reports we'd like to see resolved so we can have a vote in the House. The gentleman correctly points out that the Sustainable Growth Rate formula and its program expires at the end of the year. Certainly, our committees are at work trying to see a way forward, as well as trying to seek out the proper budgetary pay-fors necessary for the plan that's been put forward by Energy and Commerce, as well as the Committee on Ways and Means. I know there's been some bicameral discussions on that as well. I'm hopeful we can resolve that. But certainly, knowing full well we have to act prior to the end of the year. I'd also point out to the gentleman that there is considerable work being done on the issue of patent reform, and hope that that comes to the floor prior to the end of the year. And obviously, the larger item having to do with the Budget Committee conference headed up by Chairman Paul Ryan, and in the other body, Senator Patty Murray, and look forward to resolution there. Certainly the intention, Madam Speaker. With that, I yield back.
I thank the Majority Leader for that information, and I'm pleased that he added to the Word of Farm Bill, NDAA, and the patent reform issues the budget conference. My view is, as the Majority Leader probably knows, that the most important thing we can do for our economy is to get our country on a fiscally sustainable long-term path. Can the Majority Leader give us some information on the status of the budget conference? Certainly from a public perception, it appears that not much progress has been made, which is worrisome in light of the fact that the target date for the reporting on the conference is the 13th, or should I say the legislative directive is to report by the 13th. As Mr. Ryan has pointed out, perhaps unfortunately so, there are no consequences of that not occurring. I had urged myself, as the Majority Leader may know, that they report out by Friday of next week, the 22nd of next week, or Thursday of next week, so that we could have the conference report on the week we come back in December after Thanksgiving. Could the gentleman give us any idea of where he thinks the proceedings of the Conference Committee on the Budget stand? And I yield to my friend.
Thank you, Madam Speaker. I thank the gentleman for yielding, and would say that the gentleman is correct. Certainly, the sooner the better, as far as I'm concerned as well, about any resolution on the Budget Committee conference. I know the gentleman has spoken both to Chairman Ryan as well as the other body's chairman. In speaking to Chairman Ryan, I know that he tells me that there has been a lot of discussion, not only public discussions and meetings, but certainly his meeting with the chairman from the Senate in trying to find a way forward. As the gentleman knows, the issue that's central to these discussions is not unlike the issue that's been under discussion for some time here, and that is how do we go about seeking reform of some of the mandatory programs and in trying to reach resolution there in exchange for a commensurate relief on the across-the-board budget cuts that are currently in place. I don't know, Madam Speaker, whether they're going to meet the deadline next week or not that the gentleman says would be preferable. I know that our chairman is very mindful that the quicker the better, so we can get on about our work here in the House. I yield back. I
thank the gentleman. He mentions the sequester. Of course, almost everybody who has spoken about the sequester, including myself, the Majority Leader, and the Mr. Ryan, have indicated the sequester is not the way to reduce spending. It is a MEDAX approach, which is having very adverse consequences both to our national security structure, and I think almost every member of the Joint Chiefs of Staff has made that point. Certainly Mr. General Dempsey has made that point. But also on the domestic discretionary side, the sequester doesn't work. And the proof of that, of course, is that we haven't considered any of those bills on the floor. And the one we considered, we pulled, the Transportation HUD bill. So that I'm hopeful that, and I know Mr. Rogers is and Senator Mikulski, the chairs of the Appropriations Committee, have both indicated they hope to get a number early on. That's why the 22nd was a preferable date, if we could have reached that, so that they would have a number to which they could mark bills. Obviously, if there's not an agreement on the 302A, as the gentleman knows, very difficult then to try to bring those bills together in a conference because they're so far apart. So I'm very hopeful that the Majority Leader will use his good offices to urge resolution of the budget conference differences and a report out as soon as possible so that we can get to that process. The gentleman, I'm sure, shares my view that the shutting down of government is extraordinarily disruptive both to the general public and to those who work for the federal government, so that it would be incumbent upon us, I think, to try to get out of this gridlock on the budget process that we've been in. So I would urge him to exercise whatever and he has substantial influence to try to get us to a resolution of this issue. And I will tell him I will do the same. On another issue which you did not mention, Mr. Leader, is immigration. As you know, this issue passed very handily through the United States Senate on a vote of 68 to 32, and I'm very hopeful that we could move this legislation. I think the Senate bill or a variation of the Senate bill would pass. We've introduced an alternative in which we have Republican co-sponsorship, as the gentleman knows, H.R. 15, which is a comprehensive immigration bill which incorporates the security provision that was adopted unanimously in this House by the Republican-led Homeland Security Committee. So we believe it has bipartisan components to it, and the balance of the bill had bipartisan support in the United States Senate. The gentleman knows you've passed a number of bills out of your committees. One of them, and they were passed, of course, with partisan votes. We do not believe these bills are bills that we would support, but we're wondering whether any of them are going to be brought to the floor. H.R. 2278, which says Strengthen and Fortify Enforcement Act, which allows the state and local authorities to enforce federal immigration laws. As you know, we think that's bad policy, but it did come out of the Republican-headed committee in the Judiciary Committee. I'm wondering whether that might be brought to the floor, Mr. Leader. I yield to my friend.
Madam Speaker, I'd say the gentleman, I think he does know, we've had the discussion before about the majority's position on the Senate bill. We don't support the Senate bill, and the Speaker, I think, spoke out on that this week. Our members don't support the Senate bill, and we've said all along Chairman Goodlatte and his committee are going about a much more deliberative process, step-by-step approach to trying to address the problems with the broken immigration system. I do think I would tell the gentleman there is consensus on our side of the aisle as well as his that the system is broken and it needs to be fixed. Certainly there are differences on how to go about doing that, but we remain committed, as does the chairman, in trying to move in a step-by-step manner to address the various issues involved with immigration reform, but not to do it the way the Senate did, because as we've seen, many of those who actually voted for the Senate bill and the other body have now said they regret that vote, or they perhaps would do something differently. And I guess it's up to the House to try and address it in a way much more deliberately to try and fix the problems that exist so we don't see them happen again. And I would say to the gentleman, the House will continue its work, and in any way, as the gentleman knows, the news of this week, unfortunately, has been many Americans very unhappy with the work product coming out of this town as far as health care is concerned. And I would posit to the gentleman that a bill like Obamacare or a bill like the Senate immigration bill produces the kinds of impact and effect that we're seeing this week and last week and the prior. We don't want to commit that same mistake. We want to be smarter about it. As the gentleman knows, our committees are hard at work in trying to identify how we can help people in their health care right now, since they're facing the very real prospects of not having the health care insurance and plan that they like, contrary to the promises that were made when that comprehensive bill was passed back several years ago. In the same way, the Senate bill, the immigration bill, was passed with not a lot of focus on the detail. We intend to try and focus on the details of immigration reform, try and come together, see if we can actually have some positive reception on the gentleman's side of the aisle, both in this House and the one across the way, as well as the White House, to actually work together finally to produce a bipartisan outcome that will be satisfactory, because none of these partisan bills have ended up working. And as you see, Obamacare, case in point. That's why we have the train wreck that is upon us. It was a strictly partisan bill that came out of the Congress, House and Senate, and look what's happened. So I'd say to the gentleman, we do care about the immigration issue and want to go about reform in a smart way, and I yield back.
I thank the gentleman for his comments, Madam Speaker, and I wish that they had been demonstrated on the Farm Bill and on the Homeland Security Appropriation Bill, both of which were reported out of committee on a bipartisan basis, but were very partisan on the floor of this House. I thought that was unfortunate, but that's what happened. But the gentleman, I'd like to repeat my question. The gentleman said he wanted to deal with the immigration bill in a very thoughtful, considered way, and that he did not support the Senate immigration bill. I was not surprised at that response. I know he does not support this immigration bill. The Speaker has made that very clear. He does not support it, and very frankly, the majority of Republicans have made it clear that they do not support the comprehensive immigration reform bill. However, Mr. Leader, what I asked you was, are you going to bring H.R. 2278, which presumably passed out of the Judiciary Committee, presumably in a thoughtful, considered, discreet way, that is, dealing with individual subjects, which is the Strengthen and Fortify Enforcement Act, which allows states and local authorities to enforce federal immigration laws. My question to you, Mr. Leader, are you going to bring that bill to the floor, or any of the other 4 bills, which I'll mention as well, to the floor, so that presumably you believe those were considered in a thoughtful way, were reported out of your committee, were reported out with all of your Republican, I believe, voting for it, at least 20 of them voting for it. My question to you is, are you going to bring that bill to the floor? I yield to it, my friend.
You know, I would say to the gentleman, Madam Speaker, that's certainly under consideration as to the timing of when we bring that bill to the floor. And I would then again reiterate that Chairman Goodlatte is trying to take a holistic approach to the immigration reform issue. The bill that the gentleman mentioned, obviously one of the pieces to trying to figure this out, and do so in a way that we can affect positive results, not just result for result's sake. And I would again direct the gentleman's attention, Madam Speaker, to what's going on with Obamacare right now and how many millions of Americans are extremely disappointed in their government and certainly in the representations that were made by the White House and the President so far as that law is concerned. I don't think that we ought to be engaging in those kind of commitments when you can't deliver. So again, we want to be working together, want to be deliberative about this process, and hopefully we can move forward in a way that is expeditious and thoughtful. I yield back.
I thank you, the Leader. I said I wanted to mention the other bills because we understand, A, you'd like to talk about health care without focusing on anything else. I get that. We have a disagreement. We'll see whether the American people believe that making sure that affordable, quality health care is available to all Americans is something they're for, or whether they're against. We'll see on that. That issue was joined in the last election. That last election didn't have much in this body in terms of the issues that were contended in that election. But let me ask you about H.R. 2132, which is Supplying Knowledge-Based Immigrants and Lifting Levels of STEM Visas Act. As the gentleman knows, a lot of people very interested in this issue. This would eliminate the diversity visa program and transfer 55,000 green cards available under that program to a new STEM program that employers can use to hire foreign workers with advanced STEM degrees, master's degrees, PhDs, etc., from universities. It was being marked up and I understand passed out 20-14, again with a overwhelming Republican vote, if not unanimous vote. Again, the gentleman indicates that we want to consider the immigration issue on a thoughtful, discreet, that is, as the Speaker has said, bill by bill. Is there any expectation that the gentleman has that that bill will be brought to the floor before we adjourn for the year? And I yield to my friend.
Madam Speaker, I'd say to the gentleman, if he recalls in the not-too-distant past, it was his side that opposed that bill when it was brought to the floor. So my response will be the same. We want to bring bills together. We can work in a cooperative fashion to effect a result. And unfortunately, as the minority opposed stapling green cards to diplomas on that bill that was brought in the past, we're trying to figure out a way where we can bring something forward, actually get it across the finish line with the other body. So I yield back.
I think the majority leader knows, and I know, he has 218 votes on his side of the floor. Matter of fact, he has substantially more than that. If this bill is so good, if the last bill was so good, bring it to the floor and pass it. That's what your Speaker says you want to do. You want to pass bills item by item. But what is happening is you're passing bills out of committee, and they languish there. Just as the Farm Bill, to which the gentleman referred in the early part of our discussion, languished in the last Congress and was not reported to the floor.
Madam Speaker, would the gentleman yield?
Certainly.
I would just say to the gentleman, the purpose is not just to make sure that a vote occurs and then nothing happens. The purpose is to pass bills and then allow for the bicameral effort to get a result. That's the frustration. And if the gentleman would also note, on the Farm Bill, we actually have a conference committee ongoing now. And so the reason we employed the process we did was to get in a position that we could actually get a result, not just say we did something and fail to deliver for the people. So I would say to the gentleman again, these bills that he's bringing up all fit into a larger puzzle. We need some indication from the White House and from the majority in the Senate that they'll actually work with us. Because given the track record that this administration has amassed since 2009, there's not a lot of indication they're willing to work together. And again, I would point to the prospects of that being what's key, because this week is demonstrative of what happens when you just move without bringing everyone together. The effects of this health care law are going to be lasting on people. They're scared to go to the exchanges. They're worried they're not going to have insurance. This is the impact and result of passing laws by just one body with expecting the other body to just go along. We can't do that now because we are two separate bodies, and we need the White House and the Senate to cooperate with the majority in the House. I yield back.
I thank the gentleman for that point. He passed a Homeland Security bill he knew the Senate wasn't for. He passed appropriation bills he knew the Senate wasn't for. He passed, Madam Speaker, the Farm Bill amendments that he knew were not going to be supported in the Senate. So I'm asking him, Madam Speaker, we think immigration is a critically important subject. We believe immigration is in fact broken. We have an alternative. He doesn't like our alternative. I understand that. We understand that on this side. Perhaps the American people also understand. They don't like our alternative. Now, it passed with 68 votes in the United States Senate. He now says people have changed their mind. Maybe that's the case, but it passed with 68 votes in the United States Senate. They don't like it. Madam Speaker, I understand that. I get it. They don't like the health care bill. By the way, Madam Speaker, I'm starting to get that message. Pretty thick, takes some time, but on 46 votes to repeal or to undermine, I get it. You don't like that bill. You think it's a bad bill. We have a disagreement on that, Mr. Leader. However, apparently we don't have a disagreement on the fact that the immigration system in America is broken. So what I'm asking you, you have passed out of committee. You've passed out of committee the agricultural guest work program. Creates a new temporary agricultural worker program. That also passed on a partisan vote. None of these votes were bipartisan. There was no effort to work with the Democrats on the committee to bring a bipartisan bill, unlike Mr. Lucas or Mr. Carter, who brought bipartisan bills to the floor and saw them turned into partisan pieces of legislation with the help, frankly, of the majority party. Now, I'm asking you, the Agricultural Guest Worker Act, are we going to bring that to the floor? Again, a discreet, thoughtful, I'm sure, on your side of the aisle, addressing of a broken program. But if we don't bring it to the floor, we don't consider it, we can never get to conference, which is what the gentleman says he wants to do. I yield to my friend.
Madam Speaker, I'll just say to the gentleman again, track record of this administration and the majority in the Senate has indicated an unwillingness to sit down and talk. They've not done so. Certainly the White House has not done so on the immigration issue, did not do so on the health care issue. And again, it doesn't help the American people for this insistence on my way or the highway kind of mode of operation. And we've gotten the message now. If it's going to be my way or the highway, we'll try and do whatever we can to help people, as we did today on the floor, a bipartisan vote. Because the gentleman continues to say that we don't like the health care bill. That's true. I think the American people have spoken out pretty loud and clearly over the last 10 days or so, because indicated by the White House and the President's move yesterday. Obviously, the law is not working, right? We don't want to get into another situation like that. We want to make sure we work together comprehensively, because there is step-by-step actions that need to be taken. But we need results. We need the White House to sit down and talk to us. We don't need any more speeches. We don't need any more press conferences by the President. We need some actual talk. And on the immigration issue, they've just not come forward. They've said my way or the highway. And I'd say to the gentleman, that's not how you work in bipartisan process. Now, the gentleman complains about partisan action on the floor. Well, there is an inherent partisanship when you have a majority versus a minority. And the will of the House is reflected on the votes here. Well, the Senate is controlled by the gentleman's party. So is the White House. So to get any kind of result, such as the Farm Bill, we're going to need a bipartisan result. He is correct on that. But it doesn't mean that if we pass something in the House, it automatically has to be something the Senate will support. So, again, I would say to the gentleman, let's all try to work together. I think our side has indicated a willingness to do that. Obviously, we want to go and get these conference reports out. But we have not seen a willingness on the part of the gentleman's party, this President, to say we can work together to effect positive immigration reform, not just my way or the highway. I yield back.
I thank, Madam Speaker, the gentleman for his observations. I'm somewhat amused, I must say, Madam Speaker, because there are a few people in America who believe it's our party that's my way or the highway. There are few people in America who didn't see 198 Democrats vote to keep their government working. Not my way or the highway. We didn't get what we wanted. We didn't want that number that was passed. 198 Democrats, without exception, voted to keep this government open. 198 Democrats voted to pay the bills of the United States of America. It wasn't a question of my way or the highway. It wasn't a question of repeal or I will vote to shut down the government. 147 Republicans, Madam Speaker, voted to keep the government shut down because they didn't get their way. 147 Republicans, including, in both instances, the chairman of the Budget Committee, Mr. Ryan, voted to not pay the bills of the United States of America. 147. And they voted against the Majority Leader's advice and against the Speaker's advice. That's a problem. I agree with that. It's a problem. But no matter how much, Madam Speaker, the Majority Leader says it's the President and the United States Senate that are under money, in fact, the United States Senate has been passing time after time after time bipartisan bills and sent them to the House, where they have languished or been opposed. And finally, they were supported. That was true in the Violence Against Women Act. It was true on a bill that the Speaker, the Majority Leader and I were for, Madam Speaker, and that is for giving Sandy relief. He couldn't get more than 25% of his party to support that. All I'm saying is, if immigration is a problem, and we all say it is, and you think it needs to be dealt with in a discreet way, and you've passed bills out, why don't you bring them to the floor? H.R. 1772, the Legal Workforce Act, makes E-Verify immigration status programs for prospective employees mandatory. Again, I presume that this is one of Mr. Goodlatte's thoughtful, considered steps to fix a broken immigration system. All I'm asking is, now for the fourth time, will you bring one or more of these bills to the floor? We may not be for them, but at least they put, as the gentleman keeps saying, a bill before the House so the House can work its will. And frankly, if they're defeated, then it would be incumbent upon us to move in a different direction. But if they're just sitting there without consideration by the House, without the ability of the House to work its will, then it continues to cause inaction on a subject that all of us have expressed needs action. If the gentleman wants to quote, respond to that, I'll yield. If not, I'll go on to another subject. You want to go on to another subject? Rather than go on to another subject, let me urge the gentleman again, because when the gentleman says, "Let the House work its will," that's a wonderful phrase. Hopefully, it resonates with the American people. But the House is not allowed to work its will. Now, ultimately, as those bills I just referenced, we did work our will. Because, and we worked our will, frankly, with mostly a majority of Democrats and a minority of Republicans joining together to pass critically important legislation for this country. We couldn't get the majority of your party to vote for many of those bills. But I would ask the gentleman, if he really wants the House to work its will, and he believes that H.R. 15, the Comprehensive Immigration Bill, is a bad bill, bring it to the floor and see if the House thinks it's a bad bill. See if the House believes that it's a bill that is not worthy to be considered and passed as a fixing of a broken immigration system. I would urge my friend to bring that bill to the floor. He has the power to bring that bill to the floor. I would urge him to do so. And I yield my friend
I would just say to the gentleman, we don't want a repeat of what's going on now with Obamacare. That bill, constructed as it is by the Senate, last-minute ditch effort to get it across the finish line, I think that there is a lot that could be done a lot better in that bill.